The Delhi government has sought assistance of the armed forces to set up additional COVID facilities in the national capital. The armed forces are now playing a much bigger role, not just in Delhi, but across the country. And joining me on the show is Lieutenant General Madhuri Kanitkar, Deputy Chief of Integrated Defence Staff and the chairperson of the COVID Crisis Committee, Covid-19. General Kanitkar, welcome on India Today. Ma'am, the Delhi government has sought the assistance of the armed forces. 1,000 ICU beds, 10,000 oxygen beds to be manned by armed forces personnel to help battle this surge. Has the request reached you as yet, and can the forces set up additional field hospitals in Delhi?
Thank you, Gaurav, for calling me here, and we are here to tell the nation the armed forces is ready. It has been ready for a while, and though we've been fighting this war against COVID for the last 14 months, I assure the nation that we are all ready. And why can I say this? Because this has been declared as a war, and in a war, you have an enemy and you have the soldiers. So here it's a little different. Normal war, we have our soldiers up front and we medical people are the shoulders. But today in this war, with the virus as the enemy, the doctors and the healthcare workers and all of us, we are the soldiers, but we have strong shoulders with us. So it's a co-jeet. We cannot do this alone. And our senior leadership is supporting us in every way. We are ready for anything.
Okay. The Prime Minister was briefed by the Chief of Defence Staff, General Bipin Rawat, also by the three chiefs. What is expected of the armed forces right now, and how are you deployed on ground in aid of civil authorities, ma'am?
I think we've been already working, and our chiefs, the CDS, they've all reassured the Prime Minister that we will continue to do this in every possible way. As far as the patient load, well, we are taking a huge burden. In all our hospitals across the country today, we have more than 9,000 COVID cases who are admitted. And how do we share the burden with the entire country? Because this time we have taken on all the veterans and their dependents, which form a huge component which would have otherwise taken up beds in civil hospitals, which are empaneled for their care. But to vacate out those beds and facilitate our veterans, we've opened our doors and our hearts to them. So they're taking on all that. In addition to that, we're also looking after, within our service hospitals, wherever the district authorities have asked for, our local commanders have made the beds available. And a case and example is the large hospital at Pune. There are a number of these. In addition to that, we've been running, the last time we ran the hospital in the Sardar Vallabhbhai Patel Hospital near the T1 airport,
yes,
which has had that time 1,000 beds. We've already started functioning with 500 beds, and mind you, those 500 beds are all for civilians. And they have intensive care beds, more than 120, and all the others are 100% oxygen beds. It's completely manned by the armed forces with a little contingent from the CABF. So we're taking charge of that. We're also looking and preparing ourselves to take on such responsibilities given to us in other parts of the country as well.
Ma'am, the armed forces have perhaps the best experience when it comes to logistics, operation logistics. Are you helping with oxygen movement, apart from, of course, the Indian Air Force C-17 Globemasters? Because Delhi is gasping for oxygen, and somewhere down the line, the impression is, from the information that comes out from courts, that the right hand doesn't know what the left is doing, where the oxygen needs to go, where the oxygen is coming from. That's still, those niggles haven't been sorted out, and lives are being lost. Are the armed forces chipping in?
The armed forces is definitely chipping in as and when required. It's essentially being controlled by the government, and state-wise allocations have been given. So we ourselves are dependent on the supply which comes to us through the Delhi government, say in Delhi or any other city, and are in that same proportion. But besides that, how we are helping is transporting it within the country. The Air Force is doing multiple sorties to take them across the country. In addition to that, the carriers, the transporters, the BOMs, what we call the in colloquial language, the flats.
Yes.
They've been used for transporting, which are normally with the military. They've been used to transport those carriers of oxygen across, the cryogenic oxygen carriers. In addition to that, we've also kept 200 drivers standby in case we need some additional people, because they are very disciplined, trained people. So they would be going in and helping out as and when required. I would also like to add, because, and I think, Gaurav, this is a very important point, that our battlefield nursing assistants, they're not the regular medical, they're the soldiers, the air warriors, the naval, the sea naval sailors,
Yes, ma'am,
who've been trained in basic first aid, have been put to use in our COVID hospitals. I think this is a very important point that I'm trying to make, that when there is a war in this kind, where the entire nation is at war, there's a lot that the common man can do. You don't have to be a doctor or a nurse. I think you can volunteer, and with a little first aid training, and there's so many things. We can come to that in a while if you want, but there are so many ways the common man can pitch in. Each one is capable. Each healthy individual is capable of doing it.
In fact, I'll come to that in just a moment. But, Army always war games future scenario. In your appreciation, in the appreciation of the armed forces, are we anywhere close to the peak? Are we preparing for a big surge in coming weeks? Or God forbid, could it be months?
See, the armed forces never says this is it. We're always preparing in advance, and our op plans which are there always are catering to the worst. In this scenario, as in the other, we are looking up and supporting every endeavor that is asked of us. But don't forget, we have a huge responsibility of keeping our op preparedness ready. So the forces which are required for that, the medical people who are deployed in the high altitude, they're all there. So we will never let that be diluted while continuing all the extra duties.
There is a lot of anxiety at this point of time, and the moment somebody tests positive, the inclination is to rush to hospital. Can COVID even be managed at home? Are the armed forces doing that for military personnel and families, and can that experience help on the CV street, ma'am?
Thank you so much, Gaurav, for bringing up this point, because I feel there's a huge chunk, almost 80% of people remain very, very mild, and they don't need to panic at all. And we've conveyed this to all our troops. In fact, we rarely really admit them. And in that, we are very lucky, because we have been able to ensure, though the vaccines were made available initially, there was a bit of resistance from our common people. But I'd like to share this, that our soldiers, sailors, air warriors, no one hesitated. And today we can proudly say that 98 to 99% have had both the vaccines. So that's, of course, whenever it opens up and whenever possible, I think if you're vaccinated, I would love to tell the people that they really have their first armored protection themselves. The second thing is, don't we care for a cold or a flu at home? We don't panic. So let's start looking at COVID just like any other flu, where majority would be. But because it's more infectious when we get it, I would request people to say, okay, I've got it. Be comfortable in your own home instead of rushing to a hospital, and watch out for simple signs. Take your paracetamol, drink your adequate fluids, keep away from the rest of the people, especially if you have young children or elderly at home. Wear your mask, and ensure that you just look out. Even that, we are running, I'll come to that in a while, we are running this telemedicine service, and people are so scared that they whole day keep checking their pulse oximeter, and every minute, like now from 96, it's become 95, doctor, what should I do? And they panic. So I don't think that is required. So as long as you're not breathless, you're comfortable, check it a couple of times a day. And I think that is the crux which is going to manage 80%. So, I'll request all you people on channels, those numbers frighten people. So tell the good. Say, out of so many people are doing so well in their own homes. Okay. I think that's the message one I'd like to give. The second is, okay, you have got a little cough, the fever is more, the oxygen is dropping a little bit, But so what? If you do have a facility of, and today, societies, housing complexes, they're coming up with or using oxygen concentrators and things at home. And there are simple things that if your pulse oximeter shows a little less, we tell everyone do the 6-minute test. Just walk around in your room and the oxygen drives up because there. In fact, we tell them just laugh and be happy. And that raises your oxygen levels because you stop panicking. Whereas if you panic, your heart is a muscle. It starts beating faster, you get palpitations, you get tachycardia, you're using up more oxygen, and then your pulse oximeter drops from 94 and you say, oh my God, it's dropping even further. So you're creating a panic cycle. So I think that is important not to do.
Okay. Ma'am, the armed forces, like you were mentioning, General, are experts with telemedicine, with soldiers deployed at the Siachen Glacier or in the Northeast. Is telemedicine coming to your assistance now, and can that be used even to guide public at large? Because when you see a soldier, a doctor advising you in uniform, for some it's far more reassuring. Is that happening? Is it time for it to happen, especially when Delhi government says we need 10,000 beds and so many military personnel?
Yes. So I think there are two things to this, Gaurav. One is that the country came up with the eSanjeevani, a free teleconsultation platform, which was launched, and that was a spin-off which came out of COVID because it fast-tracked everything. We were applauded for having been a country which brought out their guidelines published by the Ministry of Health, and we started using. Simultaneously, we developed our own for the armed forces called Sehat. Sehat is services, e-health assistance and teleconsultation, because we had already some experience of running ISRO teleconsultation notes for our troops. But those were doctor-to-doctor notes, and they were not at the convenience of being at home. Yes. So Sehat was on similar lines where patients could contact a doctor. And today I'm so happy that we are still working on we are using the beta version. The final is ready, it should be launched any day. But even on that, we are attending, and we've reached almost near 5,000 patients, which we're handling every day. And just to add, which can again be used by others, I'd like to say that from Sehat, we've had two other babies which have been developed, and one is Sehat Sakhi. Sehat Sakhi is for people who don't have laptops at home, who are not so tech savvy. So what we've done is in our family accommodations here in Delhi, we've set up, these little kiosks where a laptop and a tele-thing is provided. Okay. So in the confines of their own complex, patients come in, and we've trained some of our own soldiers' wives how to log in and how to help people consult. Okay. So that's Sehat Sakhi. And in this time, where difficult times, and I think this is something which, again, a lot of common people can do, especially the psychologists, they're running their helplines. We are planning on something called Sehat Sakha, which is going to be for our healthcare personnel. Okay. I think the stress on them, on this war, which is carrying on for so many months, where they first looked after patients of COVID, then they went on to do the routine care of the neglected or other disorders. And before they were settling with that, came in this wave. So for that, we are also planning on launching this Sakha program, which would be a consultation for healthcare personnel.
General, in the weeks and months ahead, do you see the armed forces set up a number of field hospitals? Because the armed forces are very capable of setting up these military hospitals and very quickly in field areas. Do you see these field hospitals come up now in towns and villages with COVID, spreading to rural areas?
Yeah, there are two things, Gaurav, on this about the field hospitals. Yes, we have the capability of field hospitals and setting up and deploying them. But most of these are already deployed in our Northern Command and Eastern Command sector, and those have to remain there. And the ones which are there in the hinterland, peacetime locations, a lot of the manpower is now helping the bigger hospitals. But if you ask me, is there a capability? Our commanders are extremely adept at giving the resources for setting up such thing. But they would have to be in partnership with local administration who could provide the volunteers and healthcare personnel so that a lesser number of our personnel can train and rapidly skill up the people who are available there and get this going.
And would we require, to ease burden on hospitals in the coming weeks, would we require better home care or community care in buildings and societies and oxygen concentrators? Is that what is required at this point of time, General?
Absolutely. This, in fact, we have seen that in the last, firstly, the numbers were lesser, and it's possibly that the mutant strain has really stepped up the cases developing pneumonia and requiring oxygen. So I think self-help is the best help that can be provided. And and look at the advantage of creating something in your own environment. It's very, very unnerving. We just talked about the panic that is created when you just get tested positive. Added to that, that if you can do without going to a big, large facility or a hospital with rows of patients or patients dying in that environment can be pretty unnerving. So if you can provide that comfort, care, compassion in your own society, your own areas, nothing like it. And this is very simple. In fact, we would be very happy to provide, we've made simple protocols for mild and moderate cases with just checklist, which doesn't even require major doctors or something. So they can be together, they can be cared for, and we can give our protocols, and it would be so simple to monitor, 100 patients, 200 patients, and let them just feel secure and comfortable.
So your advice is, if you test positive, and at what stage of your oxygen should you rush to a hospital, or can you try, the proning position or something to bring your oxygen up? And are these only stopgap arrangements, ma'am?
Yes, I think that's another very important point that we call it the CARP. In fact, we can share this video that that our students have made for the community, which is what we call the COVID appropriate positioning protocol. So it is actually what it tells you is that if your oxygens are a little low, you can use your time to lie in different positions. So you lie first on one side, then you can lie on the other side, then you can lie prone, that is on your tummy with your head to the side, and this process itself raises up oxygen quite well. And then once you finish, every 2 to 3 hours, 1 to 2 hours, based on your comfort, you can get on to the position. Then you can sit up, propped up with a pillow. So I would be very happy to share that video, which our students at Armed Forces Medical College have made.
Sure.
And this can be run and spread across, so people feel very reassured that the oxygen is coming up. So that is the CARP protocol and the 6-minute walk test.
6-minute walk test, the CARP protocol, and laughing. You say if you lie on your stomach and laugh, it increases oxygen, does it?
I think anytime you laugh, it will raise your oxygen. You laugh, you whistle, you deep breathe. It not only causes you to feel good, it relaxes your stress, and it definitely brings down your oxygen requirement. So you feel comfortable, you feel good, and you feel light. So I definitely would recommend that strongly, so that instead of everyone ki COVID ho gaya and making a long face, I think it's important to say, theek hai, COVID ho gaya, ab to sabko ho raha hai. Let's go on with it and see what I can do.
Okay. General Kanitkar, for the moment, many thanks for joining me here on India Today. Coming to the aid of civil authorities and also of people in general. Hope to have you back on the show in the coming days and week. For the moment, many thanks. I now
Thank you and Jai Hind.
Jai Hind, ma'am. Jai Hind. Thank you very much for joining us. I now want to take